Thank you for choosing the Crystal Clinic Orthopedic Center for your upcoming hip surgery. We are proud to have received disease-specific care certification from the Joint Commission for Total Hip Replacement, so you can be assured that you'll receive the highest level of care while you're in the hospital. As a hospital dedicated to orthopedic care, our goal is to help you recover more quickly and to get you back to the activities that you enjoy sooner.
This education video will help you understand what to expect before, during, and after your surgery. We highly recommend that you have a family member or friend helping you at home, someone we call a coach, for at least a week after surgery. We believe that the more you learn, the more empowered you'll be during your healing.
My name is Heather Saylor, and I'm a registered nurse and patient care coordinator. We're very glad that you chose us for your surgery. My team and I are going to talk to you today about what your upcoming surgical experience is going to be like. This video will cover how to prepare you, your coach, and your home for care after surgery, what to expect in the hospital for your surgery, and explain what our rehabilitation team will teach you for a safe return home.
As part of your recovery after joint replacement surgery, you will also need a walker for moving around safely. Please bring this with you on the day of surgery. It's normal to have swelling at the site of the incision after your surgery. The more swelling you have, the more pain you will have. We will keep some form of ice to your incision site to decrease the amount of swelling. This may be an electronic machine that you have purchased from your physician's office, or it will be ice bags that we will supply within the hospital to you for use. Keep an eye on your ice because it is important to keep the hip cool. Once you are home, you will want to ice your hip immediately and continue icing regularly throughout the day for the next week after surgery. After the first week, you will continue icing after stretching exercises and throughout the day as the hip and therapist dictate. Your therapist may recommend that you participate in a preoperative physical therapy evaluation. Your therapist will evaluate your current ability and function and educate you and your coach on your precautions and post-op care. You will receive exercises to prepare you for the best outcome. If you are referred for preoperative physical therapy, your therapist will demonstrate these exercises in further detail. These exercises will improve the range of motion of your hip and strength of your leg. If you are currently in therapy for your hip, continue doing the exercises prescribed to you, as this will improve your outcomes and rehabilitation after surgery. You will have the option to have this assessment performed at one of our Crystal Clinic physical therapy locations.
Our goal at Crystal Clinic is to get you back into your normal routine as soon as possible following your surgery. One of the first ways we go about this is to encourage the concept of wellness by how you dress. We want you to dress for success. This is a very simple but empowering step. By wearing your regular clothes, the expectation is that you will mentally begin to focus on becoming healthier and stronger. With that in mind, you'll want to pack 2 or 3 sets of loose-fitting clothes, including elastic waistband pants, comfortable walking shoes with rubber soles, no flip-flops or anything backless, a hygiene or cosmetics bag, educational material provided during therapy sessions, binder or handouts, magazines, books, and any device that you use regularly, like a smartphone or iPad. If you have a CPAP machine, TENS unit, or ice machine, please bring those items with you to the hospital on the day of surgery. The night before surgery, there are a couple of things you can do to help prevent infections. Place clean linens on your bed. Take a shower as the last thing you do before going to bed that night, using an antibacterial soap or whatever soap is recommended by your surgeon. Make sure you wash with a clean washcloth, paying special attention to the surgical site. When you get out of the shower, use a clean towel to dry yourself. Then you'll want to put on clean pajamas. At the hospital on the day of your surgery, you will be given an antibiotic to help prevent infection. When you come into the hospital on the day of surgery, you'll start at the registration desk. Staff there will review your personal information. You will need to bring your insurance cards and a photo ID with you. It is also important to bring a medication list with the name and dosage of each medication. We want to make sure that after your surgery, we get you back on your regular medications. We'd also like for you to bring a copy of your living will or durable power of attorney. After registration, you will go to our same-day surgery area. where you'll be prepared for surgery. Your surgeon will see you before surgery and mark the surgical site. You will also speak with an anesthesiologist to discuss the anesthesia for your surgery. Please do not bring jewelry or money with you to the hospital. After surgery, you will go to the recovery room, also known as PACU or post-anesthesia care unit. You will be there for at least an hour and possibly longer. During this time, the PACU nursing staff will be keeping a close eye on your vital signs, such as your heart rate and blood pressure. In recovery and during your hospital stay, we'll monitor your pain level as well. Pain is measured on a 0 to 10 scale. 0 is no pain, and 10 is the worst pain you can imagine. We will work with you and your surgeon to keep you as comfortable as possible during your stay. While we can't make you pain-free, our goal is to keep you around a pain level of 3 to 5. Once you are doing well and waking up easily, we're going to move you to your room.
The majority of our inpatient RNs are orthopedic nursing certified, meaning that they are specially trained to care for orthopedic surgical patients like yourself. This means you can expect consistent, high standards of orthopedic care as well as better patient outcomes. Our goal is to work together to help you prepare for returning home after surgery. Upon settling into your room, you'll meet your nurse. Your nurse will take your vital signs, complete a neurological assessment, and listen to your heart, lungs, and stomach. Your nurse will also orient you to your room and assess your pain level. Your nurse will inform you of pain medication your doctor has ordered and the next time you're due for it. Remember, your pain medication is ordered as needed, so be sure to request it when you need it. If you need to get a hold of your nurse for any assistance, please use your call button located at the side of the bed. It is the big red button at the top of the device. Remember, your safety is our primary concern. Your nurse will review your call don't fall agreement with you. The agreement is between you and the nursing staff that you will always ask for help when getting out of bed. You'll be attached to devices such as an IV, pneumatic cuffs, and ice machines that will make it very difficult to get up without assistance. We want to keep you safe during the hospital stay. Please ask for help. Call don't fall. In order to prevent pneumonia and keep your lungs healthy after surgery, your physician will order that you use a spirometer, along with coughing and deep breathing 10 times every hour while you're awake. It is important to increase your lung breathing volume during the course of your visit. Your nurse will review this with you during the admission to your room. Your physician has ordered that you start out with a clear liquid diet after surgery. Shortly after arriving to your room, you will receive a clear liquid diet tray with soup broth, jello, lemon ice, and hot tea. If you're able to tolerate the clear liquids, you may be able to advance to solid food and order off the menu that's provided to you. The nursing staff will make rounds about every hour during waking hours and about every 2 hours during the nighttime. Staff will be asking you to rate your pain, ask if you need assistance with changing your position, ask if you need assistance to use the bathroom, and if you can reach all of your possessions. Our goal is to try to anticipate your needs and to ensure your safety and that you have a positive experience. Don't be surprised if your bowel movements are delayed a day or so. This is normal and occurs due to a lack of diet and movement and is a side effect of pain medications. During your pre-admission testing appointment, the nurse will review what over-the-counter medications you will need at home to help with this.
As a part of your recovery, therapy and nursing staff will encourage you to get up and moving the day of surgery. The therapist will spend time with you reviewing your exercises for circulation. The therapist will ensure that you and your coach understand all aspects of the rehabilitation your surgeon has prescribed. Therapy assists with other aspects of preparing you for homegoing. This includes safety tips for navigating your normal daily activities and self-care, such as bathing and dressing, so that you and your coach are prepared for the transition home. After you're home, it is important for you to continue with exercises you've been taught by your therapist. We'd also like to encourage you to continue to get up and walk at home to increase circulation and blood flow throughout your body. A gentle walking program on flat surfaces, up to 3 walks per day for about 10 minutes each, will help you to feel better and promote healing. When you are discharged, your nurse will review your incisional care instructions determined by your surgeon. You can reference your surgeon's protocol for a complete list of activities you should refrain from doing. You may need your coach to assist you with bathing, dressing, exercises, and many household activities. Your physician will specify how much weight you are allowed to support on your operated hip. You may be instructed to follow some restrictions at certain points in your recovery.
In order to leave the hospital, you'll need to meet specific discharge criteria. Your therapist will make sure you complete all your therapy appropriately so that you feel confident about managing your care at home. We will also confirm that you understand how best to manage your care at home. Additionally, we'll make sure you have medical clearance, the prescriptions you need, and have the physical therapy or nursing arrangements made prior to leaving. We realize this is a lot of information to remember, so just to recap, here's a list of items you should pack for your stay with us. Loose-fitting clothing, comfortable rubber-soled walking shoes, no flip-flops or backless shoes, hygiene or cosmetic bag, photo ID, insurance cards, updated medication list, all documentation from your doctor's appointments, pre-admission testing and preoperative physical therapy, CPAP, TENS unit, or ice machine if applicable, and any books, magazines, or devices you use on a regular basis, such as smartphone, iPad, or laptop.
Thank you again for choosing the Crystal Clinic Orthopedic Center for your hip surgery. We hope that you have found this education video to be informative and helpful in answering some of your questions.
Through education and communication, your procedure will go smoothly. Let your physician, nurses, or therapists know if you have any questions about your upcoming procedure. We are happy to answer all your questions to ensure a successful surgery and a quick and healthy recovery. We wish you well.